Hey everyone, and welcome to this explainer. I'm super excited to have you here today. We are going to be diving deep into a topic that is literally the backbone of hospital safety, infection control, and environmental protection. Yep, we are demystifying the biomedical waste management rules of 2016. Whether you're a medical student gearing up for exams, a nurse working on the floor, or a hospital admin trying to lock down that perfect NABH accreditation, mastering these rules isn't just about passing a test, it's genuinely about saving lives. So let's jump right in.
To really wrap our heads around the gravity of what we're dealing with, just think about this number for a second. 1.5 to 3 kilograms. That is the amount of waste generated per bed every single day in a typical tertiary care hospital. Now, if you scale that up to a 1,000-bed facility, you're looking at tons of waste daily. And out of all of that, about 15 to 25% is strictly biomedical waste that requires highly specialized handling. The sheer scale of this daily challenge is massive, and getting it right is just non-negotiable.
So, here is our roadmap for today's explainer. First, the hospital waste challenge. Second, the 5 steps of management. Third, the color-coded bin system. Fourth, treatment and safe disposal. And finally, safety rules and compliance. Let's get to it.
Kicking things off with Section 1, the Hospital Waste Challenge. Before we can manage all this waste, we really need to define what it actually is and why mishandling it is such a big deal.
According to the Environment Protection Act of 1986, which is governed today by the updated rules from 2016, biomedical waste is defined as any waste generated during the diagnosis, treatment, immunization, or research of human beings or animals. So we're definitely not talking about your standard office trash here. This is highly regulated, biologically active, and potentially lethal material.
The stakes here? Absolutely massive. If we fail to dispose of this waste properly, the fallout is disastrous. We're talking about severe hospital-acquired infections. We're talking about the transmission of bloodborne pathogens like HIV, hepatitis B, and hepatitis C, which often happen through severe needle stick injuries to our own healthcare workers. And outside the hospital walls, improper dumping leads to serious environmental toxicity. Plus, from an administrative side, messing this up means severe legal penalties and failing your quality accreditations.
With stakes that high, we obviously need a foolproof system. That brings us to Section 2, the 5 steps of management.
The life cycle of biomedical waste actually follows these 5 exact chronological steps. Step 1, segregation at source. Step 2, collection and storage. Step 3, transportation. Step 4, treatment. And Step 5, final disposal. Now, if you take away nothing else today, I want you to burn Step 1 into your brain. Segregation at source is the absolute hero of this entire story. Separating the waste correctly, the exact second it's generated, is literally the most important action. If you mess up Step 1, the whole system just falls apart.
So, how exactly do we successfully segregate at the source? Well, we move to Section 3, the color-coded bin system. This is the actionable, everyday core of our explainer.
Let's start with the yellow bin. Whenever you see yellow, I want you to think highly infectious and anatomical waste. If you've got an amputated body part, or say a mother's placenta from a delivery, it goes in the yellow bin. What about a cotton swab or a bandage that's heavily soaked in blood? Yellow bin. Blood bags? Yellow bin. It's also the catch-all for expired medicines, chemical waste, and cytotoxic drugs. Basically, remember this. Anything deeply biologically contaminated or chemical in nature goes straight into yellow. Okay, moving on to the red bin. Here's a really great mental shortcut for you. Red is for flexible plastics and rubbers. This bin handles your contaminated plastic items, things like IV tubes, catheters, and urine bags. Now, pay super close attention to the gloves here. People ask me all the time, hey, if my plastic glove is covered in blood from a surgery, doesn't it go in the yellow bin? Nope, because it's plastic, it still goes right into the red bin. Red is strictly for plastics and rubbers that can eventually be sterilized and recycled.
Next up is the white bin. Now you'll notice this one is a translucent, puncture-proof container. White is exclusively for metal sharps. Anything that can cut, pierce, or cause physical harm to someone goes in here. We're talking metal needles, stylets from IV cannulas, surgical scalpels, blades, and those little lancets you use for random blood sugar testing. Because these items pose the highest risk for needle stick injuries, they absolutely must be locked away in this tough, puncture-proof white box.
Our final biomedical bin is the blue bin. Blue is your go-to for sharp glass and specific body implants. You're going to drop your glass vials, ampules, broken glass slides, and even metallic body implants like old pacemakers or dental crowns right in here. But hold on, take a look at that crucial note at the bottom.
If a glass vial contains a cytotoxic drug, like a cancer medication, it does not go in the blue bin. Because of the toxic chemical risk, that specific glass vial must be thrown into the yellow bin.
Actually, I want to pause here for just a second to clear up a massive point of confusion. This trips up so many people in daily practice and on exams. Syringes. If you have a syringe where the needle is permanently fixed and can't be removed, like an insulin syringe, the entire thing goes into the white bin. Why? Because of the sharp metal. But if you can twist off and remove the metal needle goes in the white bin and the plastic syringe body goes into the red bin. It's simple but absolutely critical to get right.
The 2016 guidelines also lay out some fascinating and incredibly specific statutory rules, particularly around fetal material. If a pregnancy terminates at under 24 weeks, or if the fetus weighs less than 500 grams, it's medically classified as waste and goes straight into the yellow bin for safe disposal. However, if it's over 24 weeks or over 500 grams, it's legally classified as a stillbirth. At that point, it is no longer considered waste. It has to be documented with a death certificate and handed over to the family for proper rights.
All right, so the waste has been successfully segregated. What happens next? That brings us to Section 4, Treatment and Safe Disposal.
You can think of this table as your ultimate cheat sheet for the final fate of this waste. Yellow bin waste is highly infectious, right? So it goes straight to the incinerator, burning at massive temperatures between 850 and 1200 degrees Celsius to turn it into ash. Red bin plastics are sterilized through high-pressure autoclaving or microwaving, then they're actually shredded to prevent illegal reuse before being recycled. White bin metal sharps are autoclaved, dry-heated, and shredded into tiny pieces. And finally, blue bin glassware is deeply disinfected and sent off for recycling.
But to actually get the waste to those treatment plants, hospitals have to run a super tight, fast-paced internal schedule. Waste is collected from operation theaters every 2 hours, from the ICU every 4 hours. Laboratories clear it at the end of every shift, and general wards are cleared 3 times a day. And guys, here is the golden rule of transport. Under zero circumstances is biomedical waste ever to be wheeled through patient corridors. Plus, by law, waste cannot be stored anywhere in the hospital for more than 48 hours total.
Okay, we've covered the life cycle of the waste. Let's wrap things up with Section 5, Safety Rules and Compliance. Because let's be real, protecting the healthcare worker is just as vital as protecting the patient.
If you memorize only one protocol for your own personal safety today, let it be this one, the Needle Stick Injury Protocol. If you ever get pricked by a contaminated needle, step 1 is to wash the area immediately with soap and water. But listen to me carefully here. Do not squeeze or milk the wound. Doing that can actually draw pathogens deeper into your tissues, and there is no way we want that. Step 2, report it immediately. There is a strict zero-tolerance culture for hiding injuries. From there, you'll undergo a risk assessment, baseline blood testing, and if needed, immediate initiation of post-exposure prophylaxis, or PEP, followed by very strict medical follow-up.
And here's a kind of surprising fact for you about handling hazardous spills on the floor. While most places are phasing out old mercury thermometers and blood pressure cuffs, they're definitely still out there. If you drop one and the mercury spills, never ever try to clean it up with water or a mop. Water will literally only spread the hazardous toxicity around. Instead, what you do is carefully collect those little liquid mercury beads using an empty syringe, securing it so it can be safely reused or properly recycled.
So, what's the big takeaway from all this? Biomedical waste management is way, way more than just passing an audit or avoiding a hospital fine. As the Ministry of Environment's official motto perfectly puts it, nature protects if she is protected. By obsessing over segregation at the source, memorizing those bin colors, and strictly following these 2016 rules, you're actively protecting your patients, your colleagues, and the environment that we all share. It's a massive responsibility for sure, but it's one we are entirely equipped to handle. So the next time you throw something away in a hospital, ask yourself, are you just tossing garbage, or are you actively deciding the health of your environment?